Hi friends, today's in this series of fluid therapy, I will talk about dextrose saline, that is DNS. It is 5% dextrose with 0.9% sodium chloride solution. First is the disclaimer. This channel, Caring Dogs YouTube channel, does not provide medical advice, and information available on this channel does not offer diagnosis or advice regarding the treatment. Information provided by this channel is for educational purpose only, and information provided here is not to be used as an alternative to healthcare professionals' diagnosis or treatment of any person or animal. Please seek the help of a medical expert for diagnosis, prevention, and treatment of the medical illnesses. There is no endorsement for any brand or company. Friends, 1 liter of the DNS, that is dextrose normal saline, contains sodium equal to 154 milliequivalent, and chloride is also the same, that is 154 milliequivalent, and this 1 liter of DNS contain 50 grams of glucose. And if we see in 100 ml of this fluid, the 100 ml of this fluid contains glucose as 5 gram and sodium chloride as 0.90 gram. This fluid is basically corrects the dehydration as it replenishes the extracellular electrolytes sodium chloride and also provides the energy. It rapidly corrects the sodium chloride deficits like 0.9% isotonic saline. DNS also restores sodium chloride level in the extracellular fluid compartment. However, it does not correct the intracellular dehydration as we see in dextrose 5% cases. So DNS only expands the extracellular fluid volume. It is suitable for hypovolemic shock, especially in the patients who have dehydration with hypovolemic shock. But we have to be very careful or cautious when we give rapid infusion of DNS, because large volumes of DNS can lead to hyperglycemia-induced osmotic diuresis, and it will increase the urine output in partially corrected shock patients. This fluid is compatible with blood transfusions. So DNS is isotonic, making it compatible blood transfusion, unlike dextrose 5% which is hypotonic. The indications for giving the DNS as a IV fluid are: first is the correction of the salt depletion and hypovolemia with energy supply. DNS helps to replenish the sodium chloride levels and expands the extracellular fluid volume while providing the energy through dextrose. It is used for correction of the vomiting or nasogastric aspiration induced alkalosis and hypochloremia with calorie supply. DNS helps restore sodium chloride levels and pH balance while providing the calories to manage hypochloremic alkalosis caused by vomiting or nasogastric aspiration. It is the fluid which is compatible with blood transfusion. Since it is isotonic, it is compatible with blood transfusions, making it suitable choice for patients requiring fluid replacement and blood transfusions. Contraindications of DNS are anasarca. Especially the DNS should be used with caution in patients with anasarca. Anasarca is generalized edema, especially if it is caused by cardiac, hepatic or renal diseases, as excessive DNS can exacerbate the condition. Hypovolemic shock, we usually don't prefer DNS because DNS is not preferred here, is not the preferred choice. NS is the preferred choice for severe hypovolemic shock as a replacement with large volume fluid, because rapid infusion of DNS leads to hyperglycemia and osmotic diuresis even in the presence of fluid deficit, which can worsen the shock. If the patient is having fluid deficit and having hypovolemic shock, the suitable fluid is the normal saline only. But if we infuse DNS rapidly, it will further cause the hyperglycemia and osmotic diuresis. So It will further aggravate the fluid deficit. Therefore, using the DNS solely for the supply of salt solution to correct the shock and providing energy is not justified. With this, I conclude my topic. Martin H. Fisher has said, observation, reason, human understanding, and courage. All these makes the physician. I hope you liked this video. Thank you very much.